Hi, Dr. Sasse here from Sasse Surgical. I'm just sharing some really interesting scientific data which emerged recently that was presented at the American Society of Metabolic and Bariatric Surgery at the scientific sessions. And this one examined the risk of stroke among people who were similarly overweight or obese, a group of whom had metabolic surgery and a group of whom did not have surgery but just continued to manage their excess weight through the usual means that all of us are doing with diet and exercise and counseling and medications and all the things that our providers and friends and family have told us to do. So what is stroke? So a stroke is a very serious problem because it involves losing some function in our brain, and it happens because there is reduced perfusion or reduced blood flow to some part of the brain tissue. And most classically, people will develop a stroke. It comes on pretty quickly, pretty abruptly, and then immediately that section of the brain stops working, so that a person might find that they're no longer able to move their arm, for example, or they're no longer able to have their speech function properly. Or it could be any other thing that the brain controls, including thoughts, including motor activity, including sensory perceptions. Strokes generally occur because of a few mechanisms. They often occur because of buildup of atherosclerotic plaque in the arteries, and those arteries can become very narrow up in the brain tissue, and when the blood supply gets reduced, those areas can lose the blood supply and it can kill the cells and have some tissue death. Also, plaques can break off and travel in those little arteries and go and block off more areas of the brain. There's also strokes that can occur from a bursting of a blood vessel or an aneurysm, and that's not really the kind we're talking about here so much, but most of them are in the category that I'm describing that comes from the buildup of plaque over time. And what is the risk factors for that? Well, it goes back to obesity, high blood pressure, diabetes. Those are really kind of the principal risk factors for development of that kind of atherosclerotic plaque and the mechanisms for developing a stroke. Another thing that can contribute is that sometimes with long-term high blood pressure and excess weight, the body can form abnormal rhythms in the heart, and sometimes those rhythms can result in some plaque, and then once again the plaque shooting off and traveling up into the brain. So stroke can be relatively mild if it's a small area of the brain and the brain is able to recover afterward. But it can also be very serious, and if you have anyone in your family, kind of grandparent generation, who's had a stroke or a severe one, you know how permanent that can be, where they just simply have lost the use of the right side of the body, with both arms and legs now no longer functional, or the ability to have proper speech formation, and those are just very difficult, often very permanent results of stroke. So stroke is a terrible event, and certainly if a stroke is happening earlier in life, then it can be a very devastating problem. It's certainly something we all want to avoid. So this study examined the risk of stroke among those two groups that I described, and what they found was that the risk of stroke dropped precipitously among people who had metabolic surgery, comparing directly to matched controls, people who were similarly overweight and obese and of similar age and health. And that risk was very wide during the first year, in the neighborhood of 50%, and then even 5 years later, that reduced risk was a full 22% lower compared to the control group. So, fitting this data in context, it is very much in keeping with many other studies that have examined metabolic surgery or weight loss surgery or bariatric surgery, and comparing the people who have the surgery to people who don't have the surgery but are otherwise pretty similar. And what we find over and over and over again in a large number of studies, both the kind that are started prospectively and the kind that just look at giant populations and snapshots, is that all of them point in the same direction. They point to a robust reduction of risk of stroke as well as heart attack, and many other endpoints. Interestingly, there's a whole other body of literature that points to reduced risks of developing dementia and cognitive problems, likely both due to Alzheimer's disease and due to what's called multi-infarct dementia, or many small strokes creating dementia. So collectively, if you take a step back and look at all of these studies, what you find is We know metabolic surgery is not perfect, but we know that it also is really successful for most people. And one of the many ways that it is successful is by markedly reducing the risks of really serious health problems occurring in the few years that follow, such as stroke. All right, I hope that has been informative to hear that summarized. And with that, I wish you the very best of health and a good year.